And today we will learn about the session 4 of module 1 on diabetes. In this session we will learn what are the different complications of diabetes and how these complications are classified, and we will also see what are the effects of these complications on the human body. So let us move ahead. As you all know that diabetes itself brings a lot of complications. However, at the same time it increases the risk of various serious health complications. Now, though it increases the complications, but prevention and delaying of these complications can be done with the help of proper monitoring of blood glucose levels. Now, as you can see that these complications are actually divided into two segments, that is acute set of complications and chronic set of complications. Now, before we move ahead, let me just in short explain you what is acute condition. Acute condition is something where a patient requires an immediate medical intervention, and a chronic complication or a chronic set of complication is something like you can understand by saying it's a long-standing or persistent and continuous monitoring and treatment is required for these set of complications. So let us move ahead and see what are the different acute set of complications and chronic set of complications which diabetes has. Now, diabetes in acute complications, you can see that hypoglycemia is acute complication of diabetes, whereas there are some other complications, acute complications like ketoacidosis, lactic acidosis and non-chaotic coma. Let us see what are the different chronic complications. The diabetic complications which are chronic are basically again further divided into macrovascular complications and microvascular complications. And when it comes to macrovascular complications, they are basically CAD, CVD and PVD. Now, CAD stands for coronary artery disease, whereas CVD stands for cerebrovascular disease and PVD stands for peripheral vascular disease. We'll go in the subsequent slides and see these complications in details. But at the same time, diabetes chronic complications are also microvascular complications, and these microvascular complications are retinopathy, nephropathy and neuropathy. Let us see in details. Now we'll go first and see what are the acute complications, and as I told you, hypoglycemia is an acute complication. Now let us try to understand what is hypoglycemia. Hypoglycemia is basically a condition wherein the blood sugar levels they fall below 60 mg per deciliter in an individual. And this complication comes up with severe symptoms like headache, sweating, impaired vision, dizziness, fast heartbeat or hunger, and patient may also experience shaking or irritability, anxiety or sometimes weakness and fatigue. Now let us see what actually causes a hypoglycemic event in a diabetic patient. So an accidental overdose of insulin, this can cause a hypoglycemic event for a diabetic patient. Or there are some other reasons, like if a patient fails to eat normally after having an insulin, or excessive exercise is done by the patient, or there is a decreased drug clearance due to some pathological condition, and all these set of things can bring a serious complication like hypoglycemia for a diabetic patient. So this is a very acute condition, and in this condition patient falls and he requires a medical intervention immediately. Let us see what are the other complications. The other acute complications, as we have seen, they are ketoacidosis, lactic acidosis and non-chaotic coma. And what happens in ketoacidosis, basically all these other complications they happen because of hyperglycemia. And ketoacidosis basically is a condition wherein there is a release of free fatty acids from adipose tissues, and which in turn get converted into ketone bodies like acetone and beta hydroxyl butyrate. Whereas this condition makes a patient with a low pH of plasma, and a metabolic acidosis forms. Whereas lactic acidosis is again a similar condition wherein there is a high amount of lactic bodies are found in the blood. and body tissues experience low pH. And if we try to understand a hyperosmolar state wherein a patient can go in a non-chaotic coma, it is a similar condition like ketoacidosis, whereas the osmotic pressure increases and patient experiences a comatic condition, or the patient can land into coma. Again, all these set of complications are acute set of complications, and here the patients require an immediate medical intervention. Let us move ahead and see what are the different chronic set of complications in details. Now, before we see the complications in actual, let me just explain you the hyperglycemia in an individual brings macrovascular complications like CAD, CVD and PVD. Now, if you can see here, the heart, it happens CAD, whereas in brain it leads to CVD, and in legs or the extremities it leads to PVD, that is peripheral vascular disease. Now, CAD ultimately lands up a patient into MI or CHF, whereas CVD leads to a stroke to a patient, and a PVD ultimately leads to gangrene or amputation, and thereby all these things lead to either disability or death at the final stage. So these are the macrovascular complications. Let us try to understand what is CAD, what is CVD and PVD in details in our subsequent slides. But before we understand what are the CAD and CVD and PVD in detail, let us also see what is the beneath cause behind these macro or microvascular complications. Now, there is a term called as oxidative stress and AGEs, that is advanced glycation end products. Now, oxidative stress, you must have definitely heard this terminology, but let us understand today in detail what is oxidative stress. It is a situation, as you know, wherein a diabetic patient has difficulty in glucose uptake in the cellular level. So this condition brings a higher intracellular glucose levels for a diabetic patient, which in turn gives an mitochondrial production, high mitochondrial production of oxygen species, and these oxygen species increases the oxidative stress. Thereby it produces the advanced glycosylated end products, that is AGEs, and these AGEs are really create a problem in the macro and microvascular complications. So all these vessel disease happen due to the AGEs. Let us see what is atherosclerosis. As we discussed, that is it is a disease of vessel due to AGEs, that is advanced glycated end products. Let us see what is atherosclerosis. Atherosclerosis, as you can see, the first picture, this is a normal blood vessel where the lumen size is normal, whereas in a diabetic patient where the AGEs are at a higher side, it leads to a situation called condition called atherosclerosis, wherein there is a deposition of cholesterol on the inner wall of artery, and this deposition actually narrows the lumen size and interrupts the blood flow in a diabetic patient. And the increased oxidative stress and AGEs formation promotes this atherosclerosis in a diabetic patient. This atherosclerosis in turn leads to CAD, CVD and PVD. Let us see in detail what is this CAD, CVD and PVD. Now, CAD, as I told you, it is coronary artery disease. Basically, this disease is related to a blood vessel of heart. Coronary artery disease is a condition wherein the atherosclerotic plaque which is formed in the coronary arteries, and thereby when this clot ruptures, as you can see here in this picture, there is a plaque formation, and when this plaque gets ruptured, there is a further formation of a clot or a thrombus, which ultimately is leading to the blood interruption or oxygen supply diminished condition, and a necrosis is happening in the heart. Necrosis means death of tissues, heart muscle tissues. This condition we call as a myocardial infarction or MI. Now let us see what is CVD, that is cerebrovascular disease. The cerebrovascular disease is basically related to brain, where a blood clot interrupts the blood flow towards the brain, and which ultimately brings ischemic condition in the brain, and thereby the patient experiences a stroke. And stroke basically again is a very serious condition. Here the patient can have severe disability or even death. However, though it is a serious condition, but there are treatment available if we move fast. That is, face, arm, speech and time are the symptoms, and the time stands for that we have to act fast when a patient experiences a stroke. PVD, as I told you, PVD stands for peripheral vascular disease, and in peripheral vascular disease, it is a disease of the extremities like legs, and here you can see that there is a normal blood flow in the leg, and whereas when blood flow is interrupted due to this atherosclerotic condition in the major vessel of the leg, it ultimately leads to a gangrene situation or amputation situation for a diabetic patient, and diabetes promotes this PVD as well. Now let us see what are the microvascular complications, as again the hyperglycemic condition affects eyes, kidneys and nerves of a diabetic patient. At eyes it causes retinopathy, whereas at kidneys it causes nephropathy, and at the nerves it causes neuropathy. This retinopathy brings a condition of blindness, whereas nephropathy leads to kidney failure or end-stage renal disease, and nerves at neuropathy leads to amputation of the leg or extremities. Ultimately, all these conditions leads to the disability or death in a diabetic individual. Let us see in detail what is retinopathy, nephropathy and neuropathy. The neuropathy is basically a disease of the nerves, where the myelin sheath which is there on the nerves, it gets damaged due to the high glucose level in the blood. And these myelin sheath, when it gets damaged, the nerves ultimately get damaged, and there is a problem of neuropathy, that is signaling problem appears in a diabetic patient. So it results in impairment of functions of nerves or even neuronal death. Classification of this neuropathic complications are like autonomic diabetic neuropathy, where there is a disturbance in postural hypotension, or patient can experience severe diarrhea, paralytic bladder or impotence and impaired spatial senses. And diabetic neuropathy also brings somatic or peripheral complications like paresthesis, which includes numbness and tingling, and impaired pain, temperature, or patient is unable to experience the light, touch and sensation, and this decreases even knee jerk reflexes as well. Now a neuropathy leads to basically diabetic foot ulcers as well. Now patient can have loss of sensation, thereby there is if the patient experiences ulcers, he may not be able to identify these ulcers, and there is no pain in these ulcers, and which ultimately leads to a condition of gangrene or amputation in these diabetic individuals. So it's a motor neuropathy leading to foot ulcers, and the common sites in the trauma are like back of the heel, which is touching to the ground, or the great toe. As you can see here in this picture, the great toe is getting affected. Now let us see what is a nephropathy. Now this is a structure of glomerulus which is there in a nephron. A nephron is basically a smallest structural and functional unit of a kidney, and here in this picture this is a glomerulus, and which is called as a filter house for our body. And you can see that in a healthy individual here the glomerulus looks like this, whereas in a diabetic patient it gets affected, and thereby kidney failure is a condition where a patient can also land up. Now retinopathy, again it's a microvascular complication where it is basically a progressive disease which dysfunctions the retinal blood vessels, and again it causes a chronic, it is being caused due to the chronic hyperglycemia. This is a retina and the picture of healthy retina where there is a good blood supply to the retina, and if you see another picture here, you can see that there is a compromised blood supply happening to the retina, and the retina getting damaged due to less blood supply. So these are the different microvascular complications like retinopathy, nephropathy and neuropathy which a diabetic patient can experience. There are certain more complications which diabetes brings, like obesity, and a type 2 diabetic patient, as you all know, experiences insulin resistance, and thereby there is an increased appetite due to diabetes, which in turn leads to overeating or obesity and enlarged fat cells. This is actually a very vicious cycle. Some of the other complications also include infections. Hypoglycemic environment predisposes to various infections of bacteria and fungus. Basically, obesity and increased sweating also increases the predisposition. And fungal infections a patient can experience, and the common site of infections are like mouth or the genital folds of the skin. Even as we have seen in a diabetic foot ulcer, non-healing wounds are very common in the diabetic patients. So thank you so much. We'll definitely meet on our next sessions, and thanks for your patience listening.